South Wales will have this cleaned up in a week? And then further to that, what are our Deputy Chos or Chos saying about how long New South Wales will be a threat for?
So we want to make sure that all of our advice is taken on, any support we can bring to New South Wales based on public health advice. So I don't have any advice as to whether New South Wales will be in a position to mop this up in a week or not, or so. Obviously we hope they do. Obviously we want to make sure that they are successful, because our success depends on them being successful.
And we send people over there during our outbreak to learn from them. Are they learning anything from us? Are we advising them in any way?
Well, look, we stand ready at any time to assist New South Wales in any areas of engagement. We've learned a lot over the course of, we've all learned a lot over the course of the last 18 months as to how to respond to the changing nature of the virus and how it impacts on different communities. As recently as this year, with the great support of the Multicultural Commission and particular, especially newly arrived communities, we did some really good work in the Holiday Inn outbreak, in the northern suburbs outbreak last year with our multicultural communities. And we have shared those with our interstate colleagues, and we stand ready to share any number of learnings or experiences with New South Wales.
2 weeks into their lockdown now in New South Wales, are you surprised at the numbers today that they're going up and there's still so many people out in the community while infectious?
So it's not a question of whether I'm surprised. We have to deal with the reality that New South Wales are facing. Clearly, it's not where New South Wales want to be. Their fight is our fight, and we want to work with New South Wales to make sure that we can do whatever we can to assist. The country wants to do whatever it can to assist in making sure that they get on top of that as soon as they possibly can. That's how we all come out of this.
What do you make of, what do you make of Western Australia's tough border stance with New South Wales if they can't get on top of this outbreak?
Oh, well, that's a matter for Western Australia. I've only been briefed recently on that. How Western Australia responds is a matter for Western Australia. We'll respond based on the public health advice. At the moment, we've got the designated areas as red zones. If the public health advice changes, then our response will change.
Is this something that Victoria would do, or would you follow this kind of, this approach as well?
Oh, well, what Western Australia does is a matter for Western Australia. We'll follow the public health advice. We've got a traffic light system. We've learnt and evolved that over time. That's why I use this opportunity again to ask Victorians, please do not travel to New South Wales. Obviously, the border communities, the bubble, for those people who live in the bubble, will continue to apply. But we want to make sure that we minimise the risks associated with the continuing outbreak in New South Wales being transferred into Victoria.
Sorry, you go.
Sorry, could we put a hard border in place, though, do you think, with New South Wales and Victoria, and just stop people coming back altogether? Would that just not work?
Look, I wouldn't rule it out, but the Victoria Police advice is that they also have learned a lot over the course of the last 18 months in terms of how most effective policing is engaged to make sure that the Chief Health Officer's orders are enforced, and their advice has been that it is more effective for this highly visible, highly mobile, technologically driven responses, and they continue to advise, from the reports that I've seen, high levels of compliance and an increasing presence of VicPol on those big roads, little roads and in-between roads along the border has been quite effective.
Brett Hazard said yesterday that if New South Wales can't control transmission, then there'll be no choice but to live with the Delta variant. Is that concerning for you to hear?
Yeah, I saw those comments. So clearly the notion of letting COVID run it's not national policy. It's been a position of National Cabinet for aggressive community suppression, and that's what New South Wales are clearly attempting to do. It's what other states have been engaged with. It's the National Cabinet position. Should any jurisdiction change their policy position, I would assume they would take that back to National Cabinet for consideration. That was the forum that put in place the active suppression policy, and I would expect all of us who have signed up to that to go back to National Cabinet if we wanted that to change.
Albeit in very small numbers, we've still have had a couple of people with red zone permits out and about in the community being, warned by Victoria Police. How concerning is that, given the situation in New South Wales, and how hard is it to keep, Victoria essentially COVID-free?
Could you just repeat the last bit, Samaya?
How hard is it to keep Victoria COVID-free and to prevent leaks from New South Wales into our state?
So, overwhelmingly, the response to people who have returned from red zones has been to comply with the conditions of those red zone permits. And I want to thank those many, many hundreds, if not thousands of people who are going through that right now. But if you breach those red zone permits, you run the risk of substantial penalties and compliance activity. That's why the ADF support, our authorised office support, and VicPol support has been so important. There have been breaches referred to enforcement agencies, and people could expect substantial penalties associated with that.
When our latest outbreak was in full swing, we got some more vaccine supply sent our way. Is there any risk of the situation in New South Wales seeing any supply that's already limited diverted from Victoria to them?
So we did, at the start of, in the middle of May, get an extra 50,000 Pfizer doses, and we very quickly expended those into the arms of willing Victorians. The undertakings that we've been given since the Commonwealth, there was an extra allocation to New South Wales, but the undertakings we've been given see us essentially run into a vaccine drought from the Commonwealth over the next 6 to 8 weeks. We want to make sure that Victorians who are literally queuing up to get their vaccines can get them as soon as possible. Could I use this as an opportunity to ask the Commonwealth to again revisit their allocations to all the states, but particularly Victorians? We're above the national average in terms of the rates of Victorians who have both their first and second vaccine. Our state clinics are underutilised, really underutilised, and if Victoria got more vaccines, we could vaccinate more people and get us on that pathway to recovery sooner.
Greg Hunt said this morning that he's expecting an additional supply of Pfizer to come in August, and final negotiations are underway as it stands now. Have you been briefed on that, and could any of that extra supply, new supply that we didn't think was coming in August, head Victoria's way?
We would certainly be very keen to get from the Commonwealth anything that addresses the vaccination drought that we are facing between now and August. Victorians have demonstrated a huge appetite to come forward and get vaccinated. The only thing that is holding us back through our state clinics, our GPs back, our pharmacies back, our community health organisations back, is the drought of vaccination supply. So if the Commonwealth can source more vaccines on the global market, fantastic. We'll be out there calling for that to be put into the arms of Victorians as soon as we possibly can.
The Victorian government had essentially begged for days to receive income support during our last lockdown. New South Wales Premier Gladys Berejiklian has revealed that Prime Minister Scott Morrison is open to providing more economic support above and beyond the current package. Is that disappointing to hear, given the situation we were in just a couple of weeks ago? And do you think that should be universal as well?
Oh, well, I commend New South Wales for supporting the Victorian position, for supporting the Queensland position, for supporting the South Australian, Northern Territory, all the states' positions. That's a great position for New South Wales to adopt. I hope they're successful, because if they're successful, of course we'd be keen to apply that to all other states.
Oh, no, I meant in terms of the economic support. So the Prime Minister has indicated that there'd be more economic support above and beyond the income support package that's around. Do you think that economic support should be universal as well?
Oh, absolutely. What New South Wales is doing is doing the hard yards for all Australia. Victoria's been in that position, Queensland's been in that position, WA, we've all been in that position. And there's a role for the Commonwealth to lead in its support, to help businesses, to help communities, and to help individual workers sustain their effort in responding to these lockdowns, which are really awful, but have shown themselves to be really necessary to deliver on the Commonwealth's National Cabinet strategy of aggressive community suppression.
What kind of a message does it send to Victorians, though, who are essentially left high and dry for so long? We were in that precarious situation, and the Commonwealth resisted, and, you know, they weren't very forthcoming about that income support for a while. Look,
I'd be disappointed if there was a different arrangement put in place for New South Wales and not every other state. I'd be, our Treasurer, our Premier have all made it clear that there is a role for the Commonwealth to support communities, to support businesses, to support families through these lockdowns. No one wants them to be in place, but if we don't have them, effective for the shortest possible period of time, then the implications are bad for all Australians. So I would back the New South Wales government in their call for the Commonwealth to support all the states in this area. There is more the Commonwealth can do. We're grateful for whatever assistance they have provided us, but they're the national government, they're the Commonwealth government. They have a role here. They can't just keep outsourcing all their responsibilities to the states. They're already struggling when it comes to vaccination supply. They've got a bit of catching up to do when it comes to quarantining. I would have thought the New South Wales government are perfectly right in calling on the Commonwealth to support all the states in economic, business and individual support.
If that is forthcoming, though, wouldn't you find it frustrating that you asked for weeks and it took a Sydney lockdown for them to realise more help is needed?
Yes, I would find that frustrating. There is a clear view that sometimes the Commonwealth governments are a bit too Sydney-centric, but what I would say is that the Sydney-centric nature of what's going on at the moment is an Australian-wide issue, and we want New South Wales to be successful, getting on top of this as quickly as possible, and if that means more support from the Commonwealth, then good. That will be consistently applied across the Commonwealth.
Just on zones, any reviews coming soon on the Sunshine Coast travel zone and Brisbane? Because I understand that the cases are coming down. They still have some, but they're the Alpha strain, which isn't the Delta strain, which has been your argument for declaring these red zones because of the so-called wildly infectious nature of the variant.
Yes.
Given their Alpha cases, could that red zone come off in southeast Queensland?
So just one thing, the Alpha variant, I wouldn't want it, and I wouldn't want anyone I know to have it. So whilst it's not as infectious and nasty as the Delta variant, it is nonetheless not a pleasant thing to have. But on the broader issue, there are 3 local government areas that are currently designated red in that part of Queensland. Those figures today about the 2 cases being in quarantine their whole infectious period, that is a positive. But as Associate Professor Friedman indicated yesterday, what the public health officials need to see is an ongoing pattern of that kind of either 0 cases, no exposure sites, no community transmission opportunities. That's a positive, but they also need to see that as a pattern. They'll continue to review that. There's an AHPPC meeting early this afternoon, and when that public health advice changes for those 3 red zones, we'll be sure to let Victorians know.
There's a data engineer has crunched the numbers on his own about when our Freedom Day of sorts is going to arrive here in Victoria, and he seems to believe 80% could be vaccinated by the start of November. That would be in time for the Melbourne Cup Carnival. Does that at all match up to any sort of timeline you're working to?
So I saw those reports, and I look forward to the day that we hit 80% vaccination levels. When this rollout started, we were told that that was going to be October by the Commonwealth. That clearly isn't going to happen. The Prime Minister has set forward the 4 phases as to how this will roll out. Work's being done across the states for National Cabinet. I think it would be appropriate that National Cabinet determine these things, but clearly the sooner we get to the figure of 80%, the better. I hope it's before Melbourne Cup Day. If it's Melbourne Cup Day, I'd be very pleased.
We have mandatory vaccines or COVID vaccines for aged care workers. There's talk about potentially requiring disability workers to also have or be mandated to get their COVID vaccine. What's your position on that?
So, as I understand it, this might be an issue for National Cabinet tomorrow. Again, under the Commonwealth's original proposal, disability residential settings were going to be the responsibility of the Commonwealth. That clearly hasn't been achieved in those 1A, 1B timeframes that the Commonwealth had set. Victoria assisted in a bit of that blitz for those areas in May. We stand ready to assist again if that's the case. What we need is more Pfizer or Moderna to achieve that. We will assist the Commonwealth in any way, shape or form we can. In regards to it being compulsory, that'll be a decision for National Cabinet. If National Cabinet resolve that way, then of course Victoria will support that. But the key issue is there are disability workers and disability residential clients now who are screaming out for vaccines. They don't need at the moment for it to be compulsory. They can't get it. That's the problem at the moment. They want to get it. The problem is supply from the Commonwealth. It's the drought that we are all facing here in Victoria over the forthcoming period for vaccinations. That is our major hurdle holding us back from making Victorians safe as soon as we possibly can.
Does the Victorian government have a position one way or another on mandatory vaccine for disability workers?
So we supported the proposition when it came to residential aged care workers. We'll meet this evening post the AHPPC advice. We have yet to get any papers from the Commonwealth on National Cabinet tomorrow. We'll consider it on its merits, but I would have thought that we would support any measure that increases the delivery of vaccinations to our most vulnerable community members, all of whom, under the Commonwealth's own schedule, are already meant to be fully vaccinated.
You may be aware of a gentleman who's an infectious diseases cleaner who's been getting around in a truck with a number plate COV-19, and Vic Roads sent him a letter asking to pull that number plate. Do you know if anyone in the Department of Health, your office or in the government were offended by that number plate?
I'm not briefed on that, Simon, so that's the first I've heard of it. I'd have to get some advice on that matter. That seems like a peculiar thing to do, but that's okay. People do peculiar things.
Just on the Flinders Pier and the fight to save it and the sea dragons, David Attenborough wants to save it. That's pretty big. What do you think about that?
I'm not briefed on the Flinders Pier, I'm afraid, but I think we all want to see sea dragons flourish, particularly here at Lagoon Reserve, which I know has its own sea dragon population.
Just one other non-COVID question, sorry. I'm not sure it's one for you, but why hasn't the government committed any funding to help communities along the Great Ocean Road build affordable housing for its key worker shortage?
You're right, I'm not briefed on that matter, but what I do know is that this is a government that has a $5.3 billion commitment to social and affordable housing, the biggest budget ever in the state and the biggest budget of any jurisdiction right across the country. And if there's good work that can be done with housing organisations around key workers in that part of Victoria, I'm sure the Minister for Housing would be up for those conversations.
Sorry, just quickly, how concerning are reports that dozens of maskless partygoers were snapped appearing to breach restrictions at a Port Melbourne venue?
That venue just on the other side of that pier.
And you sought CCTV from the venue?
I haven't, but I was made aware of that by my local constituents the other evening. Vic Pol were in attendance. I understand the matter's been referred to enforcement agencies. If there are breaches of the public health orders, there will be consequences for that operator.
Sorry, just confirming, so you said that you haven't sought CCTV from...
Oh, well, it's not a question of what I've sought.
From the Department of Health was that they've sought CCTV.
Well, then I'm sure that that's exactly what's happened and that they'll work through those issues with VicPol. I know there are CCT arrangements in place on the pier there, and I look forward to those investigations establishing if the public health orders have been breached. If the public health orders have been breached, there will be consequences.
And just lastly, what do you want to make of the squatters setting up outside the North Richmond injecting centre?
I understand that Homes Victoria are engaging together with the City of Yarra about making sure that that facility is, it's not even a facility, that humpy is moved along and that the people engaged are brought into housing support services.
If I may, international arrivals have been slashed by 50% towards the end of the year, essentially. Hopefully we'll get alternative quarantine by then. Are you planning on retaining all of your hotel quarantine contracts in the meantime?
So, as the Victorian Government has made clear, it's entered into these arrangements with the Commonwealth to make sure that we help the Commonwealth in delivering on their constitutional responsibility for quarantining. It's how we manage risk, particularly in settings that aren't designed for this sort of risk, and the Delta variant has highlighted that. So we've entered into arrangements in good faith with the Commonwealth that this will be a part of how we deliver our obligations on hotel quarantine. And when those obligations change, I think from the 14th of this month, we'll continue in hotel quarantine arrangements with that reduced figure. I look forward to those facilities at Mickleham coming on as soon as we possibly can, and they'll form part of whatever the cap at that time is.
Can I just clarify, will you be retaining all of your current hotel quarantine contracts while our international arrival caps is lowered?
I'd have to... Our commitment to the Commonwealth is to make sure that we deliver on all of the numbers that we said we would deliver on. At the moment, that's about to be halved for a period of time. When these new facilities come online at Mickleham, that will form part of those arrangements. What the consequences of that for other parts of the hotel quarantine system we'll work through.
Thank you.
Thanks, everyone. See you again in sunny Port Melbourne one day soon.
Yeah, wise choice. Yeah, I think our threshold was 30 minutes, so after that, it's like... We were just transitioning to this music. Yes.